Hello and thank you for coming to this webinar. My name is David Ogden and I'm the pharmacy team leader at the Courtyard Clinic. I'm going to speak to you today about coping with side effects and understanding interactions with other medications. So what's in the talk? Well, basically I'm going to talk about side effects and try and help you understand how common they are and how you can perhaps think about managing them yourself, but also when do you need to contact us when you need some help. I'll also talk about drug-drug and drug-food interactions, because it's not just drugs that interact with other drugs, it's also food interactions as well. What are they? I will explain those and why they're important. And also, I hope to show you, if you have connection to the internet, how you can get some more information about interactions and how that works in general practice as well. And when do you need to check that you may have an interaction? So, just going back to side effects now, it's true that pretty much most drugs have side effects, but actually, they're usually quite short term and they're not serious, but there are long-term side effects that we are concerned about in clinic particularly, but as I say, most side effects are not serious and it is uncommon or rare for serious side effects to occur. The way that side effects are actually graded according to company information that they have on the drugs, the leaflets that you have inside the drug packs tell you a lot of information, but they actually categorise side effects into 5 different groups of how common they are. So you have, if you've got a side effect that happens in greater than 1 in 10 people, that's greater than 10% of the time, then that's very common. But actually, right at the other end of the scale, less than 1 in 10,000 people would be considered a very rare side effect. And it helps to kind of understand just what the risk is of having a side effect. And what we try to do here in the adherence clinic that pharmacy runs is we try to talk about the risk of having particular side effects to help you understand when you choose a medicine and you know the risk versus the benefit. But I think you need to use caution. If you look at a patient information leaflet in one of the boxes of medicines, it will list everything that has ever been experienced in the drug trials with that drug. And that's kind of a legal responsibility that the companies have to tell you about what possible side effects there have been. And what we don't know in the trials sometimes is just how rare those side effects are. And actually they may only report 1 case of a very severe skin reaction, for example. And then when it turns out actually, when we have the drug used in many thousands of people, actually it's a lot less common than they saw in the trials. And that's quite common, as we don't generally know how common some of these side effects are until a drug is licensed. But particularly the rare and the very rare ones, some of those appear once a medicine has been used in lots of people. So please don't think that you're going to get all of the side effects in an information leaflet. Usually you might experience 1 or 2 side effects, and they're probably short term and mostly they're tolerable. But obviously we need to be mindful. And one of the things that we do here is we take a great interest in one of these drugs, tenofovir, which is very commonly used. It's also in the combination product Truvada. And if we look at 1,000 people who are exposed to that drug, this is a graphic of 1,000 people, and actually about 10 of those people in 1,000, which is 1 in 100, or a 1% chance that that there would be some kidney toxicity. And what I mean by that is the drug irritates the kidneys, and we have to switch you off that drug. Now that's why we ask you for a urine sample when you come to clinic. So that's picking up on what Helen told you in her talk about what tests that we do. We do blood tests as well to check your kidney function, but we also can tell what's happening with your kidney from a urine sample. And we look for things like protein and glucose in the urine. It tells us a lot what's happening. So we're monitoring that for you. You probably wouldn't know it was happening if you got it, and we'll pick it up if you attend for your regular tests. So going back to what are common side effects, well, I think generally what we know now with the antiretrovirals that we use at the moment is generally thinking from the top of the head, probably poor sleep, dizziness is quite common initially, and in the longer term sometimes we get mood changes, and certainly some of the drugs can cause stomach upset and feeling sick, that nausea feeling. Nausea is the name that we give to feeling like you want to vomit. And then people actually vomiting is actually not that common, to be honest. It's much more common to feel as if you want to. Diarrhea can be a problem with some of the medicines. And also thinking about the skin, there are a number of drugs that we use that can cause a mild rash. And some of the medicines can cause a rash that we would need to stop the drug. So we're very interested in knowing if you've got a skin rash. Tiredness, again, sometimes when you start treatment that's quite common, but if it persists then we probably need to investigate it. The only drug that we know for certainty where we could avoid somebody having a side effect is actually abacavir, and for about 10 years now we've had access to a test which looks at your tissue type, an HLA type, and we can predict who would actually be allergic to abacavir. But unfortunately we don't have a similar test for the other antiretrovirals, so we have no way of knowing whether you would have allergy to those other drugs. But in terms of managing it yourself, there are some things you can do, and we're not suggesting that you actually sit at home and suffer these side effects, because we're very conscious of the fact that when you experience side effects, you perhaps don't want to take the medicines, and that's not what we're here for. We're here to support you, but we think in the short term, when you start a new regimen, it's not uncommon to experience a bit of nausea and possibly vomiting, but generally, in that case, it's better to take medicines that do that after you've eaten, with food or just after, because actually it protects the lining of the stomach from the drugs and the irritation. Also, you may find something like ginger root tea can be very helpful when you've got nausea. It's quite settling and it allows you to be able to eat afterwards. You could try that. But obviously, if you're vomiting and it continues, you need to seek some help for that. Now, diarrhea, loperamide is generally effective, and you can buy that at the chemist. But if it's ongoing for a few days, you need to watch your diet, and actually increasing soluble fibre will help reduce a runny, watery diarrhea. But I think if it does persist, you should still come and see us. Headache. It's not uncommon to experience headache in the first few weeks of treatment, and generally paracetamol is effective for a headache, but you do need to make sure that you don't take more than 8 tablets in 24 hours, and don't take it with any other medicines that contain paracetamol. Tiredness, I mentioned that, and I did say when starting treatment, but the thing about longer term tiredness, it has a lot of different causes, and I think it's probably best to discuss this with the clinic. So where can you find more information about side effects? Well, actually, this booklet written by NAM, National AIDS Manual, and it's on the AIDSmap website. You can actually access it. I think Helen gave you the web address, which is shown on this slide. And if you use the username and password, you'll be able to access these. And the great thing is they have them in all the European languages usually. So they're not just in English, you'll access them in your own language hopefully. And the nice thing about them is it's got some nice graphics that help you understand about what side effects are, and they're obviously the unwanted effects of a medicine, but describing what are short term, what are the longer term ones, and I think just to say about longer term ones, we do worry about the bones, the bone health, and also your risk for cardiovascular disease, which can be raised because sometimes the fats in your blood and sugars rise when you're on antiretroviral treatment. So we want to make sure that you're monitored for those in the long term. But you can help us by telling us if you have persistent side effects. So the long-term side effects shown here just describe basically that you should be attending a clinic that monitors you. Now you know that Helen has told you that we do monitor you and we take it very seriously, so you don't need to worry on that particular issue. We're already doing that. And the good news is changes to body shape are no longer a risk if you've never been on zidovudine, stavudine or zalcitabine, old drugs, but we no longer use them. So we now no longer need to tell you that you will experience body shape changes. So this has changed, this is recent information, and this leaflet has not yet been updated. So when should you seek help? Well, basically, if it's a persistent side effect, and especially if it prevents you from taking the medicine, and we don't want that to happen. We want you to be able to tolerate the medicines, to take them every day, and really feel free to discuss this with your doctor, the nurse, or the pharmacy team. We're there to support your adherence to therapy. Now, serious side effects are those which may be quite sudden. They might even require you to have to visit the ward. You may have to come in and stay overnight. But things such as abdominal pain, that's not normal. If you get dark urine, if you feel sick, or if you have a fever, then these are reasons why you should contact us. I mentioned a skin rash. Sometimes they're just mild and they're not even very itchy, and you see them, but they go away with continued treatment. But if they do get itchy, and particularly if they involve the mouth or your eyes, then you really should seek advice as soon as possible. So we advise you to come to our hospital, because actually you need to be with the clinicians who actually are treating you for your HIV infection. Vomiting that continues. You can't absorb the antiretrovirals if you're continuing to vomit. And particularly breathing difficulties. Sometimes that's a sign of allergy to one of the medicines. Please call us when the clinic is actually open. And if you really can't wait till then and it is acute, serious, obviously you can go to accident and emergency out of hours, or you can call the ward here that looks after our patients. So I want to talk a little bit about drug interactions, and I appreciate this topic is probably beyond the scope of a 10-minute presentation, to be honest. However, I want to give you a flavour of the extent of the problem and some simple advice and some resources that will help you. And just to say, that graphic there, that picture is of all the tablets that people used to take years ago. And actually, it's not really got that much simpler. Drug interactions we would have hoped that there was less now. In fact, arguably, there's more than there used to be, because we have more drugs, we have more antiretrovirals. And so I just want to give you a flavour of why that's important. But, you know, in the old days when we first had Saquinavir, was a protease inhibitor that we had, and it was actively encouraged that patients drink a pithy grapefruit juice because grapefruit juice actually improves the absorption of Saquinavir. And but actually we know now that grapefruit juice does things with other drugs as well, and actually on every statin I think there's now a warning not to drink grapefruit juice with it because it actually can make the drug toxic. So on the one hand, we had grapefruit juice that was a good thing for HIV protease inhibitors, but on the other hand, it's bad for statins. So it's a complex area, is the food-drug interaction. But we do use food, obviously, to improve the absorption of antiretrovirals quite often. And actually, they're better tolerated after food quite often as well. Now, drug-drug interactions is probably the biggest area that my pharmacy team gets involved in. And I have to say, again, we have another drug here where there's a beneficial interaction. And ritonavir was in fact a licensed antiretroviral in its own right about 20 years ago. But the doses we used then were about 12 times the dose that we use now. And around then we discovered that it actually it inhibited the metabolism in the liver and in the gut of the protease inhibitors and a lot of other drugs, and we actually used that to good effect. And that's why we still use ritonavir today, is a little dose called a boost, and that's why they're used with protease inhibitors so that you can take them once a day. If you didn't have that boost, you'd have to take your protease inhibitor maybe twice or even 3 times a day. So we call them boosted protease inhibitors. So that's an example of a beneficial drug-drug interaction that we use in clinical practice. However, there's some new ones that are coming through now, things like tenofovir and diclofenac. Diclofenac is otherwise known as Voltarol, and Voltarol is a non-steroidal anti-inflammatory drug. People with arthritis use it, people with rheumatological conditions, and sometimes it's used for short-term use when people get a sort of injury to a musculoskeletal injury. Now, using those two together is a risk factor for getting acute renal failure. That's kidney failure to you and me, and that means you'd end up in hospital. So even now we're learning about things that are still a problem, and that's something we're very vigilant now, is if people get prescribed something for an inflammatory condition and they're on Truvada or tenofovir, then we would like to know about it. So drug interactions can be beneficial or they can be harmful, and the harm is quite often toxicity. However, it can also mean that the antiretroviral levels actually fall in the bloodstream, and if that happens, then we can get a failure of the drugs to treat your infection appropriately and effectively. So actually that means your viral load will go up and your disease will progress. So it's really important that we get the balance right, that we know about all those drugs. So why are they important? Well, really the drugs are metabolized in the body mainly by the liver and the kidneys. And these are the two organs that actually get rid of drugs from the body. And it's quite interesting that the liver takes these complex drug molecules and it chops them up, a bit like a sushi chef, chopping them up into smaller drugs and making them more soluble so that they can actually be then eliminated by the kidney. Or sometimes they go into the intestine and they come out in the stool. But the interesting thing about food as well is that it actually increases or decreases the absorption of medicines. And other drugs can actually compete with the metabolism for antiretrovirals in the liver and the kidneys. So the drug levels in the bloodstream, they can go up or they can go down, and that's why why that's important. So looking at it here, we've got a nice little graphic which shows a stomach at the bottom. That's supposed to be the stomach, where when you swallow a medicine it goes into the stomach, and that's where the process of it dissolving and starting to be absorbed into the bloodstream. Now, Eviplera and atazanavir need the stomach to not be affected by any drugs that would reduce the amount of acid in the stomach. If you remember, the stomach needs acid to start breaking down the food that you eat, and also some drugs rely on there being acidic condition in the stomach. Now, of course, if you've got heartburn, or if you suffer from stomach ulcers, and you end up on a drug like omeprazole, that's otherwise known as Losec, then that's a problem, because actually it completely neutralises the acidity in the stomach, and it does so for about 24 hours. So when you take a dose of Eviplera or atazanavir, it's not absorbed effectively, and so that would lead to lower levels of the antiretrovirals in your bloodstream, and then it wouldn't be able to treat the virus effectively. So that's why I've coloured those interactions in red. Interestingly, we're using a lot of what we call integrase inhibitors now. I'm not sure whether you've been told about that yet, but they're basically the names we use: raltegravir, or there's a preparation tablet, a combination tablet called Triamec. It's got an integrase inhibitor in it called dolutegravir. Both of these can be affected in the stomach by minerals, things like magnesium, aluminium, calcium. We call them divalent ions. I don't know if you remember chemistry at school, you might remember they have 2+ charges on it. They're positive anions, and basically the minerals tend to bind, they form a complex with the integrase inhibitor, and it makes them that they don't actually get absorbed into the bloodstream. So again, we've got an area where a drug interaction can happen that happens in the stomach, and we haven't even got to the liver or the kidney yet. So now in the liver, we know we've got a good interaction there between ritonavir and protease inhibitors. And but an example of a really bad interaction is one we've known about for a long time, is ritonavir with simvastatin. And we don't use simvastatin if you're on a boosted protease inhibitor, because actually it would put you at risk of muscle pains, and that's a side effect of statins, is they can affect your muscles. Finally, I mentioned the diclofenac-tenofovir interaction, and again, this is one that happens at the level of the kidney. And all non-steroidal anti-inflammatory drugs carry a risk of causing kidney toxicity, but adding that into tenofovir, which has that really small risk of 1%, suddenly it might transform that risk to 20%. So you see the relationship between side effects and the risk with tenofovir. You add in another toxic drug to the kidney, and suddenly your risk of getting kidney toxicity might be 20-fold increased risk. So it's really important to think of drug interactions also as causing more side effects. So we're very keen to be aware of what drugs you're taking. Now, this website is actually a little bit complex, and I'm not suggesting that you should all try and use this on a daily basis, or but actually if you jot down the web address here, this website is run by the University of Liverpool, and pharmacists and health professionals in the specialty, we use this website as a source of information to help us make decisions about whether it's safe to use two different drugs together, or whether we need to not do that. And it's quite complicated to use, but what happens here is that you actually select, it's got tick boxes, and you select your regimen that you're taking. And then what you do is you click next, and then it allows you to select the non-antiretroviral drugs that you're taking. Maybe you're on a blood pressure medicine, or you're taking an anti-epileptic drug, or whatever, and eventually it will produce a table that looks like this. And what's quite useful here, and I would hope that you might be able to direct your GP to this, or any other doctor that's treating you, because actually on this website it shows traffic lights, and a red traffic light means that these drugs should not be used together. So that's quite simple. They just do not get prescribed together. That's the best advice. Where it's green, it's a little green diamond on this website, that's safe, and it's okay to use those drugs together. Where it's actually amber is a question of where we're not sure, and that's when you call us. If it's amber, call the pharmacy. So we're always happy to help you find your way with drug-drug interactions and drug-food interactions. You can speak to us when you're visiting clinic, or you could arrange at reception to make an appointment with pharmacy if you want to discuss your medication that you're taking. We are keen that you help your GP in particular if you discuss with your GP about your diagnosis and also about the drugs that you're taking for HIV infection. We would encourage it, because they may be prescribing you drugs in the future for another condition, and actually them knowing about this website will really help them provide safe and effective care to you. And if it's red, they shouldn't be prescribed together. If it's green, it's absolutely fine, but if it's amber, call us. So making sure the doctor knows, it's actually very important. We prescribe medicines for the virus here in clinic, but you may be accessing care in other areas for other conditions, and the communication between the two is very important. So allowing the clinic to write to your GP will help us enormously in making sure that they know the list of medicines that we are prescribing. And if you're able to tell them about the website, then the GPs can actually check when they prescribe anything new to you, whether it's safe to do so. And if you're prescribed new medicines, you can always speak to us. If you don't want to speak to the GP about it, please contact us. And it doesn't matter whether they're tablets, capsules, inhalers. There's actually a lot of interactions with some of the steroid inhalers that we're very keen to know about, particularly if you're on a boosted PI. Sprays and even eye drops, and sometimes ointments, steroid ointments, can be absorbed through the skin because you're on a boosted PI. And particularly an injection for joint pain. There are some clinicians that are doing injections and they're not aware of this interaction, and we want you to make sure that they know that if you get offered an injection into a joint, that you actually get them to check if it's safe with your medication. And finally, if you take vitamins, minerals, herbals, please tell your doctor or discuss it with pharmacy. We can help. Remember, if you're on a integrase inhibitor like the Triamec or like the Raltegravir, then vitamins and mineral tablets, a multivitamin, might actually not be good to take at the same time as those. We can help you with that, so please call pharmacy in these situations. And that concludes my talk. Do you have any questions?